Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello everyone, welcome to this episode of All Things Policy. I'm your host Suman, and today I'm joined by my colleague Vanshika, and we're talking about a topic that may seem less serious for India at the moment, but if ignored can have very far-reaching consequences on our future. Hi Vanshika, how are you doing today?
Hi, Suman. Thank you for having me here.
You've been studying this topic of obesity. While the more informed amongst us probably know that this is a problem in broad strokes, but could you give us an overview of the scale of the problem, not just India, but worldwide? What is the scale of the problem?
Yes, Suman. Thank you. So, as you rightly said, the World Health Organization considers obesity to be one of the most neglected public health problems in the world today. And I'll explain why it is such a big problem. So let's start by just defining it so that people understand that obesity is a very serious medical condition, right? It's characterized by an excessive accumulation of body fat to the extent that it poses a risk to your health significantly. And definitionally, obesity is measured using the BMI, which is the body mass index. Yes, it is an imperfect measure, but it is a useful rule of thumb. So anyone above 30 is considered obese.
The BMI above
30 is considered obese, yes. So as I'll elaborate now, obesity has actually doubled since the 1990 among the world population, and it has quadrupled among children. So according to Lancet, more than 1 billion people today are obese. And why that is a problem is because obesity leads to the increasing likelihood of more disabling diseases like diabetes, cardiovascular diseases, liver diseases, cancers. And these ultimately need more extensive and costly interventions later on in life. So this is one of the primary reasons why obesity should be considered a big public health issue.
Yeah. I'm just going back a little. Yes, obesity is a problem. The scale of the problem has risen manifold. But in economic terms, we look at government intervention, or we say that we need a government intervention when there are specific market failures, right? So, and again, market failures, there are definitions around that. So, obesity is an individual specific thing, right? So, if that is so, and it is my interaction or my action does not have an effect on others, then there is the externality, or that issue does not arise. But still, we look at this as a public health or a problem that will have ramifications on the public health system as a whole, right? So, what are we talking about? I mean, what are the costs involved? How does this affect all of this?
Right. Thank you for asking that question. So first, I'll start, since you brought out economic costs, I'll simply say the economic costs. So obesity puts a huge burden on the public health and the state in general. So if we see India, over 1% of its current GDP, obesity costs more than 1% of its current GDP. If we see OECD countries, the healthcare costs come to up to 3% almost of their total GDP. And in terms of public healthcare infrastructure, all over the world, more than $900 billion per year is spent. And as you rightly said, why is obesity a market failure, right? What are the externalities? So here I'll bring out why I consider obesity to be a market failure. One, because obesity leads to increased healthcare costs because of comorbidities and other diseases, these costs are borne by the system through one, the public health system, and two, by higher insurance premiums. So like you said, individuals who are not obese also share the financial burden of obesity. One. Second, obesity leads to reduced productivity. It leads to increased absenteeism in work, which has broader economic implications and loss of productivity. Second, there is an information asymmetry when we talk about obesity. Why? Because customers do not have full information about the nutritional content of the food that they are consuming. So in general, there is a low health literacy, if I can say that, among the population.
Yeah, so if I had to just come in there, the rise of packaged foods in the last few decades, owing to convenience, owing to a lot of other research maybe, has increased.
Yes.
And with that, there is sufficient evidence to say that packaged foods are high in salts, are high in sugars, and all of these contribute to the health system or the health issues that a person may face, right? So that information asymmetry that's where that comes in. Go ahead. Sorry. So you were talking about the third.
Right. As you said, there is a super abundance of ultra processed, cheap, easily available snacks, right? And this also leads to misleading marketing, especially towards children, which are targeted towards them, and they don't understand that these products are actually low in nutrition. And this also leads to a behavioral exploitation because humans tend to prioritize immediate gratification. They do not realize that the long-term healthcare costs that they are bearing are a lot more than the short-term costs.
Especially in children, because the parents are making the decisions, and there is a case of misrepresentation of nutritional information. Like if you say specific health drinks or additives into milks or whatever to let your child grow taller, grow stronger, all of that misrepresentation that happens actually forms the basis for obesity in the future, right? Because if children begin to consume that sugar loaded food right from the beginning, we are setting the foundations for an obese population later on. And I think that's where the government should come in a big way, right? To regulate what goes as information on products and to regulate what companies actually talk about in their advertising marketing.
Yes, Suman, since you brought that up, only recently it was found that Nestle baby food powder had elevated levels of sugar in India compared to other countries. And this was a problem of oversight. So, like you said, how much are we regulating these companies? And why do some countries have higher levels of sugar in the same product that has lower level in another country, right? So, I think this leads to the third idea that where the government should realize and see public health as a public good, right? This is the reason why it must intervene. And the fourth way that it can intervene is realizing there is a lack of public infrastructure that supports an active lifestyle. So, how accessible are parks, are pedestrian pathways, are recreational facilities? How affordable are they? These also overlap into the causes that create an obesogenic environment and causes obesity further.
Sure. Yeah, active lifestyle is supposed to be one of the many things that we need to do to bring obesity down. And the government's role towards that is simply to get the basics right, to get walkways, to get the basics of public transport right, so that people lead more active lives, right? Yeah. Going back a little, if we had to talk about country-wise comparisons, where are we placed and why should we as a country take this more seriously than anybody else?
Right. So, Suman, if you see absolute numbers, currently around 10% of Indian women are obese and almost 6% of Indian men are obese. So, if you see these numbers are not, say, very high, but they are very high if you compare it to the 1990s level, which was 1 and 0.5%. And if we see, if we zoom out and see at the level of world, there are some Pacific Island countries which have obesity as high as 60 and 70%. If I talk about a country similar to India, I can think of Mexico, where the obesity rates are 40% among adults, right? On the other hand, we can also look at Asia, where some countries have high obesity, like South Korea, which are economically developed. But on the other hand, we see Japan, which is seen as a model because it has always enjoyed very low levels of obesity. So we see there is this unevenness, and that is also obviously attributable to governmental policies. US has one of the highest obesity rates in the world, and a lot has to do with, like you said, fast food and also portion sizes, which are very large in the US and have become a social and cultural norm almost.
Right. Yeah. Just, listeners of our podcast may be wondering that this is a rich people's problem, right? But if we look at it, for India, it's a double whammy. We are on the one hand battling malnutrition, stunting, all of those kind of problems. And on the other hand, we have obesity too. So this actually is a greater problem this is an area where we need to focus more and get our act together. I mean, do you have some kind of
Yes,
info?
Suman. As you rightly pointed out, India is undergoing a double burden, right? And also, when we think of malnutrition, we must also realize that obesity is also a form of malnutrition, right? Because there is overnutrition and undernutrition. And some analysts say that India is simply replacing one problem with the other. And so we need to realize that yes, we have a problem of malnutrition, especially in lower income families. But as we are rising and becoming a middle class country, we also see the change in diets, and that is again contributing to obesity. So if we see regionally, states like Punjab, Kerala, Tamil Nadu, which have been higher income states, have one of the highest obesity rates in the country, right? And according to NFHS, the National Family Health Survey, almost 1 in 4 Indians now suffers from obesity. So these numbers are very, very high. And India must realize that there are 28 diseases recognized by the Global Burden of Disease, which increase because of being overweight and obese.
Yeah. So when we say malnutrition, yes, it is a deficiency of nutrition. Again, when we say obesity, is also a deficiency of the right amounts, right kinds of nutrition in any person. So therefore, obesity also comes under broadly, or we can probably say that is also a nutrition problem.
Yes.
Yeah. So what do you think as policy people? I mean, we have analyzed the problem maybe, but what do you think are some things that we can do, or we can, when I say we, it means through the lens of the government, through the lens of society, through the lens of individuals.
Right. So there are 4 or 5, I think, policy interventions that governments have undertaken. So one of the first is taxing unhealthy foods. So I know this is not a very popular idea, but I like to say that there are 2 countries where this has been successful. One is Mexico. They introduced an 8% tax on unhealthy food, and they saw a reduction in consumption by 7%. And second was in the UK, where they introduced a levy on high sugary drinks.
Yeah.
And what that led to was companies reformulating how much sugar they're adding, and there was a decline of 4 grams of sugar in each and every drink. So
just one thing.
Yes.
Would reducing one kind of sugar mean that the company is actually substituting it with another kind of sugar?
Yes, Suman. So I think chemically, sucralose can be produced in different forms at different names. And there is even a lot of talk about these sweeteners, which are supposed to be very calorie friendly, but actually the body cannot differentiate between actual sugar and between these sweeteners. So the blood glucose spike that we have is said to be same. And in fact, it could even be worse because the body is not actually getting that sugar. So yes, there are, I think, some some gray spaces where these companies operate and try to flout rules. Coming back to the tax, Suman, since you work with economists and you are an economist,
not.
What do you think? Do you think taxing sugary foods or high calorific foods is going to be successful in India?
I am not so sure, because taxation in India is mired in various loopholes. Sure, taxes and subsidies are tools that the government uses to either encourage or discourage people. So when a government wants to discourage some consumption of certain things, they will tax the product high. And when they want to encourage, they will give a subsidy. Right? Both of these alter the demand supply situations in a big way. Okay? So at least the assumption or the hope is that when you tax something high, it reduces demand for that particular product. But then there are always substitutes. Okay, so depends on the elasticity of demand for that particular product also, whether taxation will actually increase or how effective taxation will be for a particular thing. So I'm not really sure that taxation will help in this situation, but yeah, surely in terms of maybe one of the instruments that the government can use, sure, we can look at taxation. Again, we have to look at it from an equity perspective too, because probably a lot of people in the lower socioeconomic criteria, in the strata, are looking at these products, say some kind of a glucose biscuit or something else, as quick nutrition, right? If you tax them high, then you're probably taking away whatever little nutrition that those people
Right.
are getting, even if it is in terms of carbohydrates or sugars, right? So it will affect the lower income people in a more adverse way. But then we have to also look at what are the consumption patterns of particular
Right.
foods across the thing, and then decide what the appropriate tax burden should be.
Right. Yes, like you said, I think we should aim at avoiding a state of micronutrient deficiency, which is what people don't really focus on. And the government has recently brought out more, fortified foods, where they're making sure breads and milk and these products have more vitamin A, vitamin D. So maybe something can be done around that,
Right. Yeah.
right? And since we're talking about food, a second policy intervention could be is regulating food labeling. So in India, we know FSSAI is the regulatory body, and FSSAI has been trying to bring front of pack labeling for a while, but there has been a lot of industry pushback. So, and if we discuss other countries, some countries like UK have a traffic light label. So there are three colors: green, amber, red. And if it's green, that means the levels of that particular nutrient are in a friendly quantity. If it's red, that means it's very high. What do you think, Suman? Are you happy with the current state of food labeling, or do you think that there needs to be a change?
Yeah, definitely needs. There is a scope for a lot of improvement on that front, at least in my experience, because unless you are a discerning reader of labels of any of these products, you're not going to be able to, decipher whether this is healthy or not. And almost all products have things that say baked, not fried. But you know that when they say baked, not fried, it means that they are using another technique, which probably is not as healthy as it is claiming to be. Right. So again, food labeling in a country like India, where literacy levels are much lower, needs to be creative, needs to think a little out of the box. And language is definitely an issue, right? Because you can't have all information in a particular language, in English, when consumers can be of so many different states, so many different
Right.
things. So, how do you bring this kind of information out is something that we need to think creatively about. And the thing that you spoke about, the banding, like green, amber, red, I think will help in a lot of ways. And they did, and when they want to, they have been able to do it. They've been, whether it, when they wanted to say that a product is pure veg or
Right.
not, you had that green labeling, right? So when you could do it for one kind of food, you can definitely do it for, say, nutrition or anything like that.
Yes. So there are other types of labeling also. For example, FSSAI for some time wanted to bring a star rating, which some countries follow. So the health star rating is that if you have 5 stars on the product, it's very highly nutritious.
It's like energy, I think.
Yes.
Like that, batteries or any of those things.
Exactly. And like you said, that would also kind of cross all linguistic barriers,
Yes.
because people would see stars and recognize how healthy or unhealthy it is. So I read something interesting was that some people said that if we adopted this, Indian sweets like Mysore Pak, Son Papdi, Peanut Chicky,
all of the sweet
these
shops
would get 0.5 stars. And so the concept of food nationalism emerged, where people questioned, is it worth it? Do these Indian sweets kind of warrant having such a low star? Do we just look at sugar content? So what do you think about this?
I mean, as an educated or as fairly more informed person about this, I know for a fact that Indian sweets or any kind of sweets, Indian sweets, brownies, chocolates, anything, I know for a fact that they are high in sugar, they are unhealthy, and one should not indulge in them too much. But I'm not really sure you can dictate food choices of people. right? So yeah, star rating may help, but then again, it's just a nudge, right? It's like of the different the menu of options that governments have, it's just one of the things that you can do. I, as a consumer, I can ignore that rating completely and go and still buy it. I am sure we will all do that at some point in time, because we do it even now. Like if you go to the supermarket and, well, as for a nudge, you can have all the healthy options in front and you can put all the unhealthy options at the back. But if I want the unhealthy option, I am going to reach out to that thing and buy it, right? So designing these kind of nudges are very, very difficult. First of all, we have seen very few cases of nudges being effective, although there has been a whole body of knowledge and there has been a Nobel Prize for nudge theory, all of that. But yeah, it is, especially in the public policy space, it may be easier in a consumer consumer behavior, or in a corporate or kind of, but in a public policy space, to design effective nudges are very, very difficult. So I don't know how effective the star rating will be, but it is one in the menu of options that we have, and we can try everything. We can throw everything at. It's a low cost. I mean, doesn't take much. Yeah, but again, we need to have a standard setting with the FSI done properly. And of late, that has not given too much confidence in, whether you talk about the spices or any of that. We don't seem to have much confidence in our regulatory bodies itself.
Right. And one last question, Suman, and we've already discussed this as a policy intervention, is having access to better physical spaces. So since you're a runner, I know, what is your opinion? And I think Bangalore has a lot more,
spaces.
Spaces, and also I think people are more conscious about their health, say, compared to other cities, especially tier 2 or tier 3 cities. Do you think the government can play a role and expand these these public spaces like parks, for example, the membership of a gym? Are these costs really a barrier to someone's health?
See, the role of the government in these kind of interventions needs to be limited, because there is the question of state capacity, how much the state can do, and two, there is opportunity cost, right? Would the government rather spend this money somewhere else? Because you spoke of running. To incentive, the government needs to do nothing in Bangalore to incentivize running, because you have a million running groups. You have, all of that goes on if you are relatively well off. There are open air gyms or in certain parks in the city where people from across different socioeconomic barriers actually use those open air gyms. I think the role of the government in those kind of interventions is merely to ensure that there are these spaces, they don't get encroached. That is basic rule of law function. And to ensure that, safety, all of those things are taken care of. So for me, the role of that government is there. The role of society actually in those things play a bigger role, because only when you have a societal framework or a societal bulwark to push these things up, you will see greater success, like what has happened with running or with other physical activities, at least amongst the higher income groups. That's my broad take on these things. Yeah, just to close, at least for me, summarizing this, yes, we all like our sweets. We all like good tasting food, but I think we need to bear in mind that health is an individual responsibility as much as it is a responsibility of the state and society to ensure that there is a healthy population amongst us, because that is what is going to get us a more productive population. That is what is going to get us more prosperity. Your final thoughts?
Yes, Suman. As you said, I think we need to shift the narrative from seeing obesity as simply a problem of our lifestyles, right? And something that's just based on personal choice. the fact that so many people around the world suffer from obesity tells us that it's more than that we need to create a more respectful and equitable access to treatment and opportunities for prevention of obesity, right? And we need to realize that this is an issue that merits government involvement at some level, and that policymakers, legislators, they all need to be involved. And yes, there is plenty to do about it. So I think this is something that needs to be ingrained in us, so that we start seeing this as more than a problem. For example, a lot of governments understand that infectious diseases and communicable diseases are a big issue, and they treat it,
because there is an externality issue.
Right. So we miss the externalities that non-communicable diseases have and the impact they have on the world and our lifestyles.
Sure. Thanks. And with that, I think we must now talk about more healthy lifestyles in our workplaces, in our homes, and everywhere else. Thank you all for listening, and we'll be back soon with another episode. Thanks, Vanshika.
Thank you so much.
If you liked our show, dive into Taksha research on technology, strategy, and economic affairs. Check us out at our Twitter handle @Takshashila INST or our website takshashila.org.in.